What does an MRI scan for osteoarthritis reveal about my joints? Imagine being able to see inside your joints in ways that X-ray images just can't show. That's where magnetic resonance imaging, or MRI, comes into play. If you're wondering what an MRI scan can tell you about osteoarthritis, let's explore the details. An MRI scan provides a clear, detailed picture of the soft tissues and bones in your joints. It can reveal cartilage damage, which is the smooth tissue covering the ends of bones. When cartilage wears down or gets damaged, it can cause pain and stiffness. MRI scans can spot this early, even before X-rays show any changes. The scan also shows bone marrow lesions, which are areas of altered bone tissue beneath the cartilage. These lesions often look like swelling or areas of increased fluid in the bone. They can be signs of early or worsening osteoarthritis and are linked to joint pain. Seeing these lesions helps doctors understand how the disease is progressing. MRI scans can identify osteophytes, which are bony growths or bone spurs that develop around the edges of the joint. These spurs are common in osteoarthritis and can cause additional pain or limit movement. The scan also shows subchondral sclerosis, which is a thickening of the bone just below the cartilage. This change happens as the bone responds to increased stress and joint degeneration. Another important feature MRI reveals is subchondral cysts. These are fluid-filled sacs that, from within the bone near the joint surface. They can cause pain and weaken the bone structure over time. MRI can also detect joint effusion, which is excess fluid inside the joint capsule. This fluid buildup often indicates inflammation and can cause swelling and discomfort. Soft tissues around the joint are visible too. MRI can show inflammation of the synovial membrane, called synovitis, which contributes to pain and swelling. It can also reveal damage to ligaments and menisci, which are cartilage pads in joints like the knee. Damage to these structures can make the joint less stable and worsen osteoarthritis symptoms. In addition, MRI can detect loose bodies, which are small fragments of cartilage or bone floating inside the joint. These can cause catching or locking sensations and may need removal. Compared to X-ray images, MRI gives a full picture of all joint tissues. It shows cartilage, bones, ligaments, menisci, and the lining of the joint in multiple planes. This makes it easier to detect early signs of osteoarthritis before they show up on X-rays. It also helps distinguish osteoarthritis from other joint problems that cause inflammation or bone erosion. Doctors use MRI results to decide the best treatment options. It helps identify which parts of the joint are most affected and how severe the damage is. This detailed view can guide personalized plans to slow disease progression, manage pain, and keep your joints functioning well. Usually, MRI is ordered when symptoms are unclear or when other imaging tests do not provide enough information. In summary, an MRI scan for osteoarthritis reveals cartilage damage, early bone changes like bone marrow lesions, bone spurs, thickening of bone beneath the cartilage, cysts, excess fluid, inflammation, ligament or cartilage damage, and loose fragments. These details give a complete picture of joint health, helping doctors diagnose, monitor, and plan treatment for osteoarthritis effectively.